Oxybutynin for hot flashes due to androgen deprivation in men. Definition: non-hormonal treatments used for menopausal hot flashes in women have generally been found to have limited efficacy against hot flashes induced by androgen deprivation for the treatment of prostate cancer in men.
Randomized controlled trial of venlafaxine versus acupuncture for the treatment of hot flashes after anti-estrogen hormone therapy for breast cancer showed that acupuncture is as effective as drug therapy but without adverse effects. A hot flash may be described as a subjective feeling of heat accompanied by profuse sweating and shivering that may last a few minutes. Patients may experience reddening of the skin of the face, head, and neck, secondary to increased skin blood flow during these episodes. These phenomena occur as a result of a decreased set point of the hypothalamic thermoregulatory center and the resultant heat loss mechanisms. This change in set point is likely due to aberrations in endorphin and serotonin levels in the central nervous system.
Application in medicine. Gabapentin and venlafaxine have been found to have limited efficacy in measures acetyl alcohol modestly effective and can have hormonal side effects. It has also associated with decrease in level of prostate-specific antigen after withdrawal that suggests stimulation of tumor growth by drug, and when the drug is used to treat cachexia, it has been associated with rapid growth of metastatic prostate cancer.
Hot flashes are the worst. Leg cramping, mood swings, loss of sex drive. I can pile on, but those are some of the main ones that you suck to deal with. At night, I'll be sleeping in bed and I'll throw the covers this way with hot flashes, and my wife will be throwing the covers that way with her hot flashes, and all of the blankets are piled up in the middle of the bed. Sometimes I have to climb over them to see her.
Pros and cons. Oxybutynin is effective for refractory hot flashes in women. In one randomized trial, 73% of women who took oxybutynin reported an improvement in symptoms, as compared with 26% of women who took placebo. Issue in Ecuador. A 65-year-old physician had a PSA early recurrence of prostate cancer detected as radical prostatectomy. He had been taking gabapentin for neuropathic pain, which be continuing. He began neoadjuvant and concurrent treatment with the developer, and because of multi-weight reparations, planned to start after 3 months.
Androgen deprivation therapy refers to treatments that are used for locally advanced or metastatic prostate cancer. These treatments deprive the body of testosterone, a hormone that is needed for the prostate cancer cells to grow. There are two main forms of androgen deprivation therapy: medical treatments, which are reversible, and surgical treatments, that is, removal of the testes, that are not reversible. Well, these treatments can have quite significant implications for men and how they feel generally in their life. These treatments are very effective in treating and managing the prostate cancer, but they can have a number of side effects.
Conclusion: a recent randomized trial of 3 anti-muscarinic drugs to treat female origin continent, oxybutynin, tolterodine, and trospium chloride, showed similar efficacy of all 3 drugs, but oxybutynin caused more side effects, including dry mouth and insomnia, than the other 2 drugs.
The question is does it make a difference which ADT you use? And surely it makes a difference. You can use anti-androgens like bicalutamide, where you have a mild androgen depression, so this is not really complete suppression of testosterone, which is felt, and side effects mean the testosterone is still within like normal levels. So when you want to achieve a fast testosterone reduction, there are 2 or 3 options. The 2 fastest ones is do a subcapsular orchiectomy, which is complicated to schedule when you have this typical Friday afternoon patient with a PSA of 1,500, hard prostate, and you